pony Pac-Man. Before purchasing him, we knew he had a severe suspensory injury in his left frontal limb right here. Now, this was caused by his previous owners overworking him, and the suspensory tore or ruptured. About 2 years after we purchased him, and he was still in good working order, he was able to jump, be ridden quite often, the suspensory re-tore. But it was only a partial tear, but it was still in the same place that the suspensory originally tore. After PRP and 6 months stall rest, plus 3 months additional hand walking on the lead rope, he is still able to be ridden and jumped. However, because of this 2 tears, he now has arthritis in his knee because the suspensory apparatus is not able to work as effectively as it would have without the 2 previous tears. And we had original aspirations to take him to the pony finals, but he, as you can see, is a large pony, so he would have to jump 3 foot. He is no longer able to jump that high. We have gotten him back to jumping 2.6, but I'm also not able to ride him as often. Also, another change after his injury are these things called suspension boots. Now, what they do is while I'm riding, it keeps the whole apparatus, ligaments, tendons, and muscles in place and secure. Keeps them warm so they're able to so they're flexible and able to move. Also, it keeps them stable because these are tight-fitting boots that are going to hold the apparatus and muscle all together so there's no overextending of anything. Start walking them while you are riding. This allows the horse to get used to bearing the weight of another person while moving in the forward direction. The next step of the rehab process is trotting. Now the key to this is you want them to trot on because it would be very easy for them just to hold a nice controlled trot. You want them to extend their legs so they're working their suspensory apparatus, making it stronger and building their fibers. Next step is cantering the horse. So you should be able to feel the same rhythm that you did before the suspensory injury. Also, a good task to show if the suspensory is still hurting is make them do lead changes. If the lead is awkward or uncomfortable, that means the horse is still hurting. And you should probably go to the smallest pace, go back to the walking or trotting before you go back to the canting. The last step would be to try jumping again. If you are able to get to all the flat work, start small and work your way up to bigger jumps.
Is not proof that one of these ways is truly remarkably better than the other.
Right.
There's an accumulation of evidence that supports the work, but it isn't like, you can easily just go through the literature and say, this is the way that you should handle it. The suspensory is a ligament, it's not a muscle. So what happens is, as an animal gets really tired, the muscles fatigue and the tendons no longer hold those joints up because a tendon attaches to a muscle. So the difference between a ligament and a tendon is that a tendon has a muscle at the top of it and then attaches to bone on the other end, whereas a ligament is bone to bone, and essentially it's an elastic strap that doesn't have muscle. So what fatigues when an animal gets tired and no longer gets as good oxygen and all of that is the muscle. And it no longer can hold the horse up, and the tendon's not helping anymore, and the load gets transferred to the ligament. So good conditioning so that the animal is fit and able to have all of the tendons and ligaments work together is less likely to blow a ligament. The most important thing is getting a diagnosis, and that's not that easy to get. If it's a significant injury, it will be easy, well, assuming that you have a veterinarian with equine experience that does a good physical exam and a good lameness exam. They can often pick up the problem by the fact that there's pain on pressure at the origin of the suspensory, and there might be heat and swelling that's detectable on palpation right at that site. And following up with trying to get rid of that inflammation. So step one, upon finding something like that, is to treat very aggressively with anti-inflammatory treatments. So that would include everything from, ice water, icing, bandaging to reduce edema, and use of non-steroidal anti-inflammatory drugs, of which the most common in horses is phenylbutazone, to reduce pain and inflammation and essentially draw the heat, inflammation, and swelling out of the area. It is important to know whether there's been actual fiber damage and destruction. And the ultrasound is pretty accurate at that. It's not as good as an MRI, but rarely would anyone MRI right away. So essentially, they would ultrasound the area, which is a sonographic method to get an image of the soft tissues around the suspensory area. And in that, then, if there's a hole in the suspensory and there's not a lot of fluid and edema there, then that can be interpreted as a tearing of fibers. Probably the most accepted right now is to inject the center of that with a platelet-rich plasma, PRP. It is a blood product that contains growth factors from platelets in high concentration and can help facilitate that to both drain. When you put the needle in, you can drain the clot that's in there, and you can stimulate a pathway for blood vessels to get in there. Plus, you can deposit the growth factors right in the site to help facilitate healing. Spray it. And if you see that there's disturbance of the quality of bone at that site, then you might actually inject with bone marrow concentrate rather than just the PRP. And there are kits that are on the market concentrating horse bone marrow, and you can get it from the sternum and concentrate it and then inject it. And we tend to poke little holes in the bone actually at just before we inject. And those bone marrow cells contain stem cells and progenitor cells that can reform healthy bone as well as, improve the healing of the suspensory ligament. And for those horses, there is a surgical procedure that is relatively new, meaning started maybe 5 years ago, where the surgeon would release the fascia in the area, sort of like releasing it so it can expand and swell, not under pain, and also cut the nerve that supplies the area to the suspensory. It's called a neurectomy. Fasciotomy and neurectomy is what it's called. Tarsal fasciotomy and neurectomy. And essentially that will eliminate the pain to the site. It doesn't do anything to heal the site. It just eliminates the pain to the site, and many of those horses then can come back and be ridden to high performance level. So I think what most people have to realize is that they can be serious injuries that could be career-ending or career-limiting, that they take a long time to heal, but that there are good regenerative medicine treatments and some surgical treatments that can get a large portion of these horses back to full use with time. And jumpers are predisposed, and standardbred trotters are predisposed, and carriage horses are predisposed. And even quarter horses that specifically slide and spin. And that's because they're asked to push off from their hind end, and hind limb suspensory injuries are the most common. And these horses are asked to push off on their hind end, and therefore their career puts them at risk. So anything that you could do to minimize that depth of push-off, so in other words, the drop that fetlock has, so, not jumping in really deep, muddy environment. So, for example, if you have an eventer, checking the field first and determining that you think it's safe and that you want to put your horse at rest. If it's really deep turf and muddy and the animal's going to really drop in deep, it's going to predispose the suspensory to an injury, and that's frequently why you'll see horses scratch out. And no, we definitely need better treatment options as well, because, ligament is tough because it is very dense tissue that has to align along lines of stress. And Mother Nature's way of healing an injury is kind of the one wound, one scar. So you start out with the same scar tissue, and then over time it has to align. So anything that could speed up the process would be very helpful. Things that can help cells align so that they regain their tensile strength faster. All of these types of things are being investigated even today. And so you might say, well, boy, what would be new and different? Well, something that was an injectable scaffold, for example, that could be injected that would line up parallel to the way the fibers you would want them, and then injecting some stem cells right into that scaffold so that these cells would grow already aligned, and then adding growth factors there as well. We also can make supercharged cells, we call them super cells, where you can engineer cells to make growth factors themselves. So they secrete those growth factors. You inject the cells, and then those cells will actually secrete those growth factors into the local area, sometimes for as long as those cells live, which might be 4 months.